also is the same, contains within it the character for opportunity. Okay? So every health issue is an issue for the person having it, right? But it's also an opportunity for the therapist and also an opportunity for the person having the issue to have some remediation, okay? Or some relief, right? Right there. You're right there.
Okay.
Thanks. Okay, so what's your name?
Danny.
Hi, Danny.
Hi, Dr. J.
Okay, Danny's a real person in real life. She is not an AI simulation. Okay, and she earlier mentioned to me that she was having an issue, and I agreed to see if I could help her with the issue. I don't know if I can help her with the issue, but I agreed to try, right, to consider it. Danny, what is the issue that you've been experiencing? Just describe it briefly, like you told me this morning.
I had an accident in 2011. I had whiplash. I see a chiropractor. I get an upper cervical adjustment, and it feels like on my lower left back, like somebody just takes the top half of my body and picks it up and turns it and sets it wrong on my legs, and I can't stand all the way up. It's painful. And I can't sit still, obviously.
Okay, we would call that the complaint, right? All right, so I'm looking at her, and she's holding her hips like this. This is a very typical posture of people who have low back pain, okay? Hip or pelvis, low back, or some form of back strain, somewhere in the back. This posture, even as they're walking around and moving around, and also they have difficulty bending over. Danny, do you have difficulty bending over?
Mm-hmm.
What did you tell me this morning about that?
I can't.
I can't. She said, I can't bend over. I'm having trouble getting up. You know, the elevator's like out of service. It's not one.
I had to roll out of bed, and I have to use my legs to walk up to stand up.
Okay, that's pretty descriptive, right? Okay, so I'm just looking at her. First thing I notice, as she's saying, I see a little bit of this sad face. That tells me something. All right, I see this posture with the hands in placement. See, what I want to do is I want to look for any indication that I can see that might confirm some aspect of her story. Do you understand? That's my objective observation. I just want to have a look. I'm not being judgy, okay? I'm just saying to come up with an idea of if I can help, what I can do, maybe whatever. I have to be able to look at the client and see, is there something that confirms what she's saying, and that it might be relative to the work that I do. Okay, so I see that. I see that posture. I see this rocking, this swaying. I see the comportment, the face, the counsel, the color, right, from the side, of course. I also see this kind of a curvature. Now let's turn around. Take your time. Just turn around, just there, right? All right, so I'll move her hair out of the way. This beautiful hair. It's beautiful hair. Oh my goodness. Maybe I'll take some of that with me as payment. Okay. So now, if of course, if she didn't have her shirt on, it would be easier to see the spine, to see the back, and also to see. But I can see things anyway. So, for example, I'm just going to pull this down. Dan, let me adjust. You can just keep your hands in front together, okay, and relax as much as you can. This will just take a minute. Okay, so I want to step back, because sometimes it's a little easier to see if you're not too close. Okay, one thing I noticed, see, this hip is higher than this hip. It's just obvious, okay? You see that there is a curve in her back. It goes this way, and then it goes this way, and then it comes out this way, and then this shoulder is higher than this shoulder, okay? So as soon as you look, you see this asymmetry, okay? Now, I'm not going to get into all the scoliosis versus lordosis, kyphosis kinds of issues, okay? I can use those terms, but I choose not to, okay? I'm not a chiropractor. I'm not doing chiropractic. I'm a Thai Achan, and I do Mara Chikitsa and Ayurveda, all right? And so guess what? We were doing postural analysis for 4,000 years before D.D. Palmer invented chiropractic. Chiropractors did not invent this, okay? They heard about it from someone else and added it to their repertoire, okay? Now granted, they use it, I have a lot of respect for them, right? I'd have more respect if they were sitting where you're sitting, if they would come and take class, all right? But anyway, I see that asymmetry. Now that asymmetry jives with what she was saying. In other words, it ain't right, right? It ain't right. This contour, pelvis, low back, mid back, upper back, shoulders, is not supposed to be going every which way. It's supposed to have a relaxed, natural curvature. Relaxed, natural. And so also, I look here and see this is in spasm. Listen. That's a muscle. Listen. Very similar. Okay, I expect the table to be firm because it has a steel and wood and foam structure. I do not expect that muscles, when I thump them, should sound like a table. So that's an indication, see, right there. But I can see the spasm. I can see that this is raised up. I can see the shoulders are raised up. Okay? And so that is guarding the neck. And also, you see this right here? You see this right here? That's spasm. Chronic spasm. So whatever she's going through now, that means, that tells it, first of all, it takes a long time to build muscle. Ask Arnold Schwarzenegger. It takes a long time to build muscle, even if you're trying to do it on purpose. Much less, she's not trying. Look at this. Now, you see the ridge? The hard ridge? Okay? That's spasm. And if I need to, I can confirm it. I get in here and I push on it, and it's hard. Now, if you want to feel what muscle feels like you forget, because you think everything is spasm, everything is not spasm. Let's go to a part of her body that she doesn't work much, like the back of her arm, like the tricep. Burp, burp, burp. When it's not under pressure. It's not mushy, but look at that. Look, I can even pull it right off the bone. I can squish it. How about if I knock on it? Same pressure. This hurts her. This does not hurt her. Same pressure. This sounds like I'm knocking on a table. This sounds like I'm knocking on mashed potatoes. Not quite. There's a little tone here. I'm exaggerating. I don't want to embarrass you. Okay? All right, so that tells me there's a lot of stuff going on. All right, Danny, I want you to sit on my table and go as comfortably as you can. I would like you to start. We're going to move around a little bit. It's going to be uncomfortable for you, okay? But the first thing I want is I would like for you to be face down in the cradle. So we have, that's why I like this Sheffield table. This is my favorite. I like this table way more than a massage table because it gives me more options for pressure. Okay, face down. Take your time. Face down. Take your time. And we're just going to do a few things. I'm not going to do a long treatment, okay? Because I already have an idea of some things that are out of whack, and I'm going to confirm them. A couple things is from here, when I look up, it's not a straight line, not by far. And also from here, as soon as she lays down, I can see the spasm in the upper mid-back. Okay, I know there's spasm here. This couldn't be any harder, but the hypertrophy or the muscle growth from the spasm is raised up here in a big bow. You see that bowl there from the side? Looks like a bowl. Okay? And I could do a few other things. I'm not going to do everything, but for example, just relax. This leg is shorter than this leg. Okay? So first we're going to do a little relaxing. In principle, this is the same thing as we do in the warm-up, except that every time I push, I'm actually digging in with the heel of my hand, and I'm moving into that groove and moving that muscle away from the spine. So I'm putting a little tension in it. So it has the impact of the rocking, which is not specific, but I'm also pushing and pulling, creating pressure and tension on the spine in the lines next to the spine, the sin lines, with this rocking motion. My posture is good. I'm actually leaning against the table to give me support. My knees are bent and my back is flat. I not have a big curved back. My belly is forward while I'm doing this. See how I actually lean forward to get pressure. I don't have to push very hard. Now, I might do this for a few seconds from one side, and then I'm going to do this from a few seconds on the other side. Rocking is good. Say it.
Rocking is good.
Rocking is good. Okay. Big breath. And out. Ah. Big breath. And out. Ah. Big breath. And out. Ha. Big breath. And out. Ha. Okay. A little more. Big breath. And out. Ha. And big breath. And out. Ha. Nice. All right, push back into chow pose. Use the chair for leverage. Lift your hips. Push back into chow pose. Good. Use your hands. Push down and sit up. So far, so good. Mm-hmm. Now turn and put your legs off the side of the table and sit. Nice, nice. Cross your leg. So right now, as best you can, what are we doing? We're doing left leg over right. Let me get rid of my glasses. Lean back against me like I'm the big chair. Okay, big breath. Exhale. Okay, change legs. Good. Fall back against me. Big breath. Exhale. Okay. That's good. Sit on the floor right in front of the table. Good. Sit any way it's comfortable, or as comfortable as you can. Scoot forward just a little bit, because I'm going to get behind you. Good. All right. Cross your fingers behind your neck. Sit up straight as you can. Take a big breath and exhale. Again. Let go. You can't see it, but I'm pushing with my knee. Big breath. And exhale and just fall, 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 fall. Just drop your shoulder when you exhale. Let your head fall. Nice. Nice. Breathe in. Breathe out. Relax.
I feel tingling all the way to my toes.
Big breath. Big breath. Ah. Big breath. Good. Okay, take my hand. Get your feet in front of you. Stand up. Come on. Up you go. Put your hand on your ear. Big breath. Exhale. Put your hand on your ear. Cross your hands. That's good. That's it right there. Hold it.
Uh-oh.
Oh, good one, maggots.
Uh-oh.
Just take a big breath. So we should have done this before, but on a scale 1 to 10, before we started working, how did you feel?
1 to 10 number.
Pain.
I was like at a 9.
Okay. Just take a breath and relax. Scale 1 to 10 right now.
Maybe 1.5, 2.
That's a little better, isn't it?
It's a lot better.
Thank you, Danny.
You want to stop? I'm done.
Yeah.
Thank you so much.
Yeah, you were out.
Yeah.
Okay, let me